Hey everyone, it's Casey, and today we are going to use our therapy balls to help release and open into the lower parts of our bodies. So think we're gonna get into kind of that lower back, we're gonna get into our glutes, we're gonna get all the way into our quads and the outer, into our IT bands. And we'll see what we got time for today, but hopefully we can get a nice, deep release. I do have two therapy balls here. These are the larger sized. If you don't have larger size, you can get away with smaller size, but we will need two of them today, side by side. If you don't have the actual set, you can grab a sock, shove a couple tennis balls or lacrosse balls in there, and just tie a knot on one end, and you basically have the same thing. I'll give options of how to use your block as we move into certain positions. So if you don't have the larger size, it helps to create a little bit extra lift and pressure where we want it, okay? So one block and two therapy balls side by side is all we're gonna need today, okay? This is a little mini release, so we're just gonna jump right on in, come down onto your back, and I want you to take your block and your therapy balls with you. So first, we're gonna start by grabbing the block, and we're gonna take the block on its lowest setting. I like to say on its belly. And then you're gonna lift the hips, and you're gonna take it underneath your sacrum, underneath the back of the hips, and just let it lie flat, nice and supported, okay? Now, if you don't have your therapy balls, you can just hang out here, but we will need them for the other positions, just FYI. So if you just wanna release here, perfectly fine. Otherwise, let's grab our therapy balls. And when they're side by side, it's really nice because you have 2 points of contact with the body versus just one. But what's nice about that is this works really well for spinal work because the spine can go down the center where there's not going to be any pressure applied to it, but you're able to access the muscles surrounding the spine that can be really, really tight and overused. So this is a nice way of kind of being able to release and get deeper into those muscles on either side, okay? For some of these, we'll need both of them. For some, we'll just need one. This is where we'll need both of them, okay? So as you lift the hips, you're gonna set the therapy balls on top of the block. And then I want the therapy balls to rest onto either side of your sacrum. So you're gonna kind of feel a firm support on either side. If you don't quite have the sweet spot, adjust it higher or lower. And it's almost like two little pressure points that you feel kind of pressing and lifting up into the pelvic, the back of the pelvic region. So we're able to get kind of that support, but also a little bit of spot treatment and focus. So go ahead and just close your eyes until, if you need to make adjustments, make those adjustments, but then close your eyes and let yourself just fully surrender. Let yourself fully just enjoy the fact that you're here. You get to let go. You get to find a deeper sense of release. So allow that release to settle in. Knees can stay bent, but if it feels good to stretch your legs straight in front of you, you can do that as well. For me, that creates a lot of pinching in this position, so I prefer feet flat on the ground, but please do what feels most appropriate for you. We're gonna give just a few breaths to kind of anchor in to this, especially if we're just starting the practice. Exhale, let everything out. Take a slow breath in, filling all the way from the belly to the chest. Everything along the way, opening, expanding outward. Hold at the top of the breath. And then open up your mouth and exhale, let it all the way out. One more time, just like that. Slow breath in. A slow, gradual increase in breath, length, depth. Hold at the top. And then open up your mouth and exhale, let everything out. If you want to take another one, go for it. Otherwise, just relax your breath back into a nice, easy rhythm. No force, let go of the control, and just ease in. A few more relaxing breaths. Okay, so from here, we want to stay nice and stabilized on our block and on our therapy balls. So if you need to hold on to them, or if you need to reposition them, like let's say if your therapy balls are right on the edge of your block where they're about to roll off, make sure they're kind of more centered, a little more stable. We're gonna slowly lift the feet off the ground, and that way we feel like we're not gonna slip off of anything, okay? We have room for the balls to roll slightly forward and slightly back. If you don't quite have that set up, readjust and then lift your feet up, okay? Now from here, without the hands, I want you to feel your knees start to pull closer to the chest, and as they do, you're gonna really feel a pelvic tilt. So feel your tail kind of start to tuck under and up towards the ceiling. So you're gonna feel more of that lower back. If you need to hold on with your hands to make sure your therapy balls don't shoot out from underneath you, you can. And then you're gonna slowly re-extend the knees back up to more of that neutral pelvic positioning. And then what we're gonna do is we're just gonna keep lowering the feet in the direction of the ground, but I want you to think about lengthening the front of the hips until maybe the feet touch, and you can kind of pull your sit bones back and emphasize that lifting of your lower back. You'll have the therapy balls kind of pressing into that upper part of the back of the pelvis. Nice. Slowly lift the feet back up, neutralize the pelvic positioning, and then same thing. Feel the knees start to pull to the chest, feel the tail start to wrap under and up towards the ceiling. Maybe hold on to the therapy balls, get that nice rounding in the lower back. And then knees lift back up, neutralize through the pelvis, and then start to extend out through the front of the hips as the feet lower down. And then just feel almost a sense as the knees roll forward that your sit bones are starting to pull back towards your shoulders. And then let's re-neutralize. Set the soles of the feet flat down on the ground, lift the hips, remove the therapy balls, remove the block, and then just let your hips rest back down to the ground. You can set the block out of your way, keep the therapy balls handy, we will need them. But as you rest flat, just go ahead and let the knees sway side to side. Okay, we're gonna get a little bit into our lower back. So we're gonna focus more on those deep, deep lower back core muscles, which also feed into the hips feeling overly tightened or strained in certain positions. So I'm gonna start on the left side, and that way you guys can get a better visual without me having to adjust anywhere from here. Okay, so feet on the ground, knees bent. I'm gonna lift my hips and I'm gonna place just one of the therapy balls. You can keep them together, it's no big deal. If you wanna take them out and use one at a time, you can do that, okay? You're gonna take one of the therapy balls and you're gonna place it in your lower quadrant on your lower back, okay? So think that lower left side, below your ribs, but above your hip line, okay? That section there between the spine and the outside of the body. Play with the quadrant, and I want you to just kind of let your body sink down, let your hips sink down, and let your body just kind of drape over one of those therapy balls. Your knees can stay pointing upward, or you can even let your knees tilt a little to the left side. If you don't feel anything, lift the hips back up, reposition it, and then settle the hips back down, play with the positioning. See if you can find it, okay? This is one of those that if you're not quite sure if you found it or not, you did not find it, okay? You'll know because there is a lot of sensation in this muscle, okay? This muscle is constantly overworked and overshortened through lack of use, lack of opening, a lack of attention. So just let yourself find it. Spend time work within that lower quadrant. It can be maybe closer to the ribs, it can be lower towards the hips, it can be closer to the spine or out towards the side body. Okay, that muscle starts in that top near the spine and ribs and comes out towards that left hip. Okay, so play within that placement here, within that section, and then just let yourself sink into it. Let yourself kind of mold into that shape. And we're going to give ourselves about 5 or 6 really deep breaths. And I want you to just focus on creating as much surrender through the body as you possibly can. Let your eyes sink back. Make micro adjustments to continue playing into that edge. 4 more breaths. Let's take 2 more bonus breaths just because it feels so good. Make adjustments as you need to. Let the knees tip to center if they're slightly askew. And then just let your knees drift all the way over to the right side until you kind of lift off of the therapy balls and are able to take them out from underneath you. And then bring the knees back to center and just kind of feel the differences in your lower back between both sides. Okay, we're going to bring balance into the right side now. So with the feet on the ground, press to the feet, lift the hips. Now, if you have the smaller therapy balls and this just is not cutting it for you because the lower back, the curve is too high, use a block underneath your therapy balls, okay, or underneath your therapy ball. And that just helps to push it up a little bit higher away from the ground. That can be extremely helpful, but it can be very intense. So be sure to listen to your body, move slowly. Hips lift up. Take your therapy ball, bring it into that lower right quadrant in your lower back. Anywhere in that space between ribs and hips and spine and right side body. Play within that quadrant. Let your hips melt down. Knees can shift a little bit. If you don't feel anything, pick the hips back up, reposition, and try again. Sometimes they're little micro adjustments. Sometimes we find it right away. Sometimes it takes a little searching. Okay, find the appropriate amount of depth for yourself in this position. You should still be able to take really, really deep breaths. Close your eyes, settle in, relax whatever you can here. Use only the effort that is absolutely necessary and let everything else go. Soften the muscles in your face, readjust if you need. And let's just focus on taking deeper breaths into the body. If you need that block underneath for a little extra push, lift, and support, please do that. We're going to take about 5 slow breaths in this position. Two more bonus breaths. Knees shift to center and then over towards the left until you can roll off the therapy ball. Remove it, bring the knees back to center, Just feel, observe your differences. If your body is like, hey, I need to hug my knees in or stretch my legs out, please take the next few moments to just move however you please. Move however your body is calling you to move today. Okay. Now, with your knees bent, when you're ready, let's cross left ankle over the right thigh. Now, when we do this and we let the hip kind of open up, we're getting a nice external rotation in the hip, and it's going to allow us to feel a little more open into the outer glutes, okay? So we want to focus on kind of the gluteal area. Once again, we're only going to need one therapy ball for this one. Small or large, you're probably going to feel it regardless of the fact, okay? So let your legs tip a little over to the right side. So you kind of feel your left hip curl up. And then you're going to place the therapy ball underneath that left hip as you let the hip come back down. And then you're going to rock up onto the therapy ball and then let your legs tip a little over to the left side. So what we're doing is we're allowing kind of that fleshy area on the side of the glutes to lift up and to sink down onto the therapy ball. So if you need to lift up, reposition, go for it. You can have it a little bit higher up on the glute. You can have it a little bit lower. I want you to ultimately find a spot that allows you to feel a good amount of intensity, a good amount of tension. So you're feeling something, but we're still able to breathe deeply and to slowly work ourselves through those layers of tension. So try to let your eyes settle back into the sockets. Close your eyes. Rest them here. Relax the rest of your facial muscles to kind of match that same energy all the way into your jaw, your tongue. And we're going to be here about 6 slow breaths. What are you engaging? What can you soften? What can you take tension away from? Two bonus breaths. Let the legs tip back to center, and then let the right hip sink to the ground, tipping the legs slightly to the side. To remove the therapy balls, the legs come back up to center, uncross your legs, and just windshield wiper your knees side to side. Maybe observe the differences between your sides once again. All right, other side, when you're ready, right ankle is going to stack on top of the left thigh. Let your legs tip a little over to the left, just enough to kind of peel your right hip up, placing the therapy ball to the outer right hip as you roll back up onto it, and then let your left hip lift up, let your legs tip a little over to the right side, kind of like a little bit of a twist. And then find that fleshy spot on the outer right side of the hip and glutes to kind of rest down into your therapy ball. Lift up, reposition as much as you need to here. Try to relax your eyes, relax your face. We're going to take about 6 slow breaths. Take whatever tension you can out of the position to allow as much surrender as possible. Okay, 2 more bonus breaths. And then gently let the left hip start to sink down until it touches, rolling a little over to the left until you can remove the therapy ball. Bring the legs to center, uncross your legs, and just move however you'd please for a few breaths. Okay, from your back, let's go ahead and just roll over onto the belly. Just roll over on the belly. Now, if you're facing the back of the mat, which you probably are, and you would rather face forward, feel free to just switch positions on the mat, especially if it helps you see more clearly. Okay, so we're gonna grab the therapy balls. This one's gonna feel great to have them side by side. So if you need to re-put them back in their little pouch, go for it. Okay, so we're gonna target through the front of the right quad, and then we're gonna get into the IT band, into the outside of the hip, okay? Now, I'm gonna place my therapy balls on that right side so that when my quads touch, I'm kind of bringing it to the center of my quad because I'm gonna need enough kind of push through my back foot to kind of roll forward and back, okay? So if it's too high up on your hip, then chances are you're not gonna have a lot of movement to go all the way down towards your knee. And if you're close to your knee, you're not gonna have enough movement to come up towards your hip. So I like to start in the center, and that way I have equal amount of push to go forward and back. And you can always adjust it as needed. So right quad, you're gonna rest it down so that you feel both therapy balls. Now on this one, I'm gonna hike my left knee out to the side, okay? Because I'm gonna use that kind of to help leverage my weight positioning forward and back. Now from here, you can tuck your right toes, and you're just gonna slowly come up onto your forearms, and you're gonna rock yourself forward and back. And I want you to go from the top of the quad all the way to the bottom towards the knee. If you need to come a little more forward on your forearms or walk it a little bit back, you can. But stay on the front of the quad. So just kind of working that here. It'll take about 5 breaths, nice and slow. Okay. Now you're gonna stay on your forearms, but kind of let your right elbow kind of open out to the side slightly. You're gonna use your left hand to help lift and pivot your hips. So now you come onto the side of the right foot, the side of the right leg, and the therapy balls are now kind of resting on the side of the right leg. My left foot is now gonna step to the ground in front, okay, with a little bend into the knee. You can adjust it wherever it feels good. And then you're gonna, once again, just start to go forward and back. Now you're rolling out the side of the right leg. You can let the right foot just kind of hover, or you can rest it down and let it slide. You choose how much weight you want to sink down onto it. About 5 more breaths. Last breath here. And then you're gonna slowly start to roll back over onto your belly. Remove the therapy balls. And as you lie on your belly, just rest your head down onto your stacked hands. Maybe bend the knees, maybe windshield wiper the feet side to side. And then the legs come back down. We're gonna go into the other side. So let's take the therapy balls, place them on the left side as you kind of come up onto your right hip. And then let's bring the left quad, the center of the quad, onto the therapy balls. And from here, you can hike your right knee out to the right side for a little bit of leverage, maybe tuck the toes. And then you're just gonna kind of start to rock forward and back, using the forearms, using that right knee. Left toes can stay tucked where they slide on the ground, or you can just hover the left foot. Choose how much weight you want to sink into it, about 5 more breaths. Okay. Left elbow kicks out a little bit wider. Use your right hand to the ground to help lift and shift so that you're on the side of your left hip now, or on the side of your left leg. Right foot kind of kicks out in front for a little extra stability. Right hand can stay on the ground. And then same thing, rock forward and back. Reposition if you need to. 5 deep breaths. And then from here, let's just go ahead and roll back on the left hip, remove the therapy ball out from underneath, and just come up into a nice comfortable cross-leg seated position. You can set the therapy balls out of your way. Spine up nice and tall here. Close your eyes, lift your spine. Let's all take a deep breath in. Holding at the top. Open your mouth, deep breath out. Let's do that again. Take a slow breath in, fill up your belly, ribs into the chest. Holding. Open up your mouth and exhale, let it out. One more time, take a slow breath in. All the way up, expand and hold. And then open up your mouth and exhale, release. If you want to take this into Shavasana for just a few moments, you can come down onto your backs. Otherwise, just stay in a seated position here, a brief rested meditation. Just allowing ourselves to be in stillness and in silence for the next minute or so. Allow yourself to fully drop in and surrender. Join your hands together at your heart center. Take a moment to just feel and connect. Setting an intention to guide you from this moment forward. If you are on your back, slowly roll over into your side, fetal position, and then press yourself back up into a seated position, joining here with hands at heart once again. Thanking your bodies for all that they do for you, being grateful for this practice and how much it can open up our bodies and our minds. Thank you for choosing me as your guide. Much love and much gratitude from me to you. Thank y'all so much. If you know me, you know I love using therapy balls in my practice, and I feel like used in conjunction with more of the physical practice, we can get a really well-rounded release into the body. So I hope you're feeling amazing, and I am looking forward to the next time we meet again.